You've heard a lot about ObamaCare. How much do you know about the Affordable Care Act? Jimmy Kimmel asked some people if they know the difference between Obamacare and the Affordable Health Care Act.
What do you agree with, Obamacare or the Affordable Care Act?
I'm more towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
And why do you not agree with the Affordable Care Act?
Well, I think it's not really available for all.
So the Affordable Care Act is more affordable than Obamacare?
Just the name says it all.
Right. You would agree with the Affordable Care Act?
Absolutely. I think it's nice that everyone can afford it, and everyone should be able to afford it, but to force people to pay something and then doctors to make something, limiting their ability to do their job, that's kind of anti-American.
Do you believe that Obamacare will eventually lead to gun prohibition?
Yes.
Do you know that Obamacare and the Affordable Care Act are the same thing?
No, they're not. Thanks, you made me look stupid.
That's what we do.
Okay, you did good.
At least she laughed about it, right?
Yeah.
But he's like, it's kind of interchangeable.
I could see everybody's eyes glaze over.
So how much do you know about Obamacare? Well, the first thing you should know is that Obamacare and the Patient Protection and Affordable Care Act of 2010 are the same thing. It's a very complex law. You may have heard that the bill itself is over 1,000 pages long, and many the people in Congress didn't read it all before they passed it. Well, who could have? It was crafted through a long negotiation process between the Obama administration and the insurance companies, and it was passed by Congress and signed into law by President Obama in 2010 with almost no Republican support, despite the fact that the bill was largely crafted following the model of a plan developed by Mitt Romney when he was governor in Massachusetts. And of course, it's been a political hot potato ever since. Many people thinking the repudiation of the Democratic Party and of President Obama in the most recent elections has a lot to do with Obamacare and opposition to it. Of course, almost no one is opposed to its basic objectives, which is more universal access to health care and a control of health care costs. Okay, let's look at some of the major provisions in the bill. The first, of course, was new requirements for health insurance plans. For one thing, insurance companies actually had to spend a significant percentage or predetermined percentage on health care rather than administrative costs, advertising, CEO salaries. There were a comprehensive list of services, you see it here, that insurance plans had to cover. Children were allowed to stay on all insurance plans, on their parents' plans, until the age of 26, and people can no longer be denied coverage or charged more on the basis of pre-existing health conditions before they acquire insurance. The bill authorized a large expansion of Medicaid through the states. Medicaid, of course, is the government-provided insurance program for low-income people. The Supreme Court ruled that states could opt out of this Medicaid expansion, and Virginia is among those states that have refused the additional federal monies for expanding Medicaid. Another very controversial aspect of the plan was the so-called individual mandate. The individual mandate requires everybody to have health insurance, and if they don't have it through some government program like Medicare or Medicaid or the VA or through their employment, then they have to purchase health insurance. Now that actually is only about 5% of the population, since people are generally either covered by a government program or have it through their employment. This aspect of the plan was thought to be essential because unless everyone is paying into health insurance, especially young people who are often thought to, or often don't purchase health insurance because they're healthy. But those folk are needed in order for there to be enough money in insurance pools to pay the health care costs of those folk who do need it. There are also provisions in the bill for small businesses. Many of the folk in our country who don't have health insurance do have jobs with small businesses who find it very difficult to afford the benefit of health insurance coverage for their employees. So there were significant efforts to attempt to make it easier for small businesses to provide that benefit to their employees. The bill includes various efforts, experiments to improve efficiency of healthcare service delivery. That is to say, to make it, to help hold healthcare costs down. Here is a quotation from an article from an op-ed piece in the New York Times, which you can read on the website, describing some of those attempts, some of those efforts. Now, of course, the bill has costs. If we're going to provide health insurance coverage for more people and give greater access, it has to be paid for. Some of that the idea would be covered through lower reimbursements to healthcare professionals. There were also higher taxes on Medicare that the wealthy would pay, and there were some new taxes on medical devices and for tanning services. Take a look at this short video prepared by the government explaining what Obamacare means for us.
Let's talk about the Affordable Care Act, also known as Obamacare, and what it means for you. Say you've got private health insurance already. Maybe you have it through your job or your parents. Obamacare means you get a host of new benefits and protections. For example, insurance companies are now required to cover women's wellness visits, mammograms, birth control for women, immunizations for kids, all without charging you a penny more. That means no extra copays or fees. Young adults can now stay on their parents' plan until they turn 26. Insurance companies can't limit the amount of care they'll cover over your lifetime. Also, if your insurance company spends more than 20% of your premium dollars on overhead, stuff like CEO salaries, marketing, administrative costs, they have to send you a refund for the difference. In January, that list of benefits gets even longer. It will be illegal to charge you higher premiums or refuse coverage because you get sick or have been in the past. Charging women more than men for the exact same coverage, also illegal. No more deciphering page after page of jargony paperwork from your insurance company to determine what they will or won't cover. Instead, you'll get a short, plain language summary of your benefits and coverage. Easy, right? You can learn more at healthcare.gov. Okay, what about the folks without health insurance or people who buy coverage on their own? Here's what Obamacare has for you. A new, simple way to buy affordable, high-quality health insurance. Starting October 1st, you can go to healthcare.gov and use the new health insurance marketplace to see all of the health plans available in your area and sign up for the one that fits your needs and your budget. You can also find out if you're eligible to pay less for private health insurance or whether you qualify for other free or low-cost programs. All the plans in the marketplace are required to cover a core set of essential health benefits: doctor's visits, emergency care, prescriptions and lab tests, rehab for illness or injury, mental health services. They all come standard. Plus, all those benefits and protections available to people who already have insurance, no-cost preventive care, coverage for pre-existing conditions, accountability for insurance companies, you get all of that too. You can apply for marketplace coverage 4 ways: online at healthcare.gov, by mail, on the phone, or in person. And open enrollment starts October 1st. You can learn more right now by visiting healthcare.gov or calling 1-800-318-2596. So here's the bottom line. Whether you need health coverage or you have it already, the Affordable Care Act offers new rights and protections that make coverage fairer and easier to understand.
Well, as of course I'm sure you are aware, the Obamacare has been quite controversial. Some people, quite frankly, don't regard its goal of expanding access to the healthcare system through insurance as morally compelling. I don't think that's a big source of opposition, but that does exist. More important, I think, is that many folks believe that less regulated markets for health insurance and, quite frankly, private charity, can better fill the gaps in coverage that exist in our society. The individual mandate is one of the most controversial aspects of the program. Some regard it as an unfair and unjust violation of individual autonomy. Why, if you don't think you need insurance or don't want insurance, should you have to purchase it? And why should you be required to purchase a plan that covers services you don't need? Now, as I've already explained, that was thought to be necessary in order to increase the pool of money available to pay for everyone's health care. But still, you can see why that would be resisted as an unfair and inappropriate violation of individual autonomy. There are a host of other aspects of the controversy, maybe not as fundamental or significant, but some argue that the bill was forced down our throats because it was passed without Republican or bipartisan support. Of course, Obama has taken a lot of heat for his claim that if you like your insurance, you'll be able to keep it, which has turned out not to be true. Of course, defenders would say that, of course, he meant if you like your insurance and it meets the requirements that the bill has created, you'll be able to keep it. Some have labeled the bill socialism or a government takeover of healthcare, saying that despite the fact that, of course, it leaves private insurance in place and leaves healthcare institutions in private hands rather than under government control. And from the opposite side of the political spectrum, many folk on the left, you might say, or more liberal folk, have protested that a true single-payer system, that is to say, a true government-provided federal health insurance program that all people were a part of, would have been more effective at increasing access and lowering costs. Well, hopefully this has given you a fairly simple and understandable account of what the Patient Protection and Affordable Care Act is, Obamacare, and some of the controversies surrounding it. As citizens and as healthcare professionals, all of us have to decide what we think is best and what we think is right in relation to these issues.